So, hello, I'm Dr. Bailey and this is
Dr. Christina.
And we're going to go over our second episode, more about the K-laser.
So what we talked about last time was a few of the things that you can't do with the laser. And Bailey's going to go over those real quick.
You cannot use it when you are pregnant. You cannot do it over active cancers, your eyes especially, which is why we showed our special glasses last time. And you can't do it directly over your thyroid gland and some heart pacemakers, things like that.
The only other thing added to that is there are a few medications that we have a contraindication list as far as since they increase blood flow or do anything with the blood, we have to double check with that medication. But that's the only other contraindication to using the laser. So if you are on medications, we do an exam before we do the laser and double check what's going on. With the laser, last time we talked about acute and chronic issues and said we'd go over them this time around. So some examples of acute would be you spraining your ankle right now, hurting yourself, twisting your back, having a flare-up of something where it just appeared out of nowhere. Those are basically acute issues. Chronic is going to be anything that possibly you've had for a while. Started a long time ago and it's now resurfaced, or you get it every year, or it happens a couple times a year. Those are going to be your chronic issues. Generally, back and neck are chronic issues, frequent knee issues, people who are in need for knee surgery, hip surgeries. There's all type of chronic stuff that can actually happen. As far as the laser and what this laser does and why it is different from other lasers is this is a hot laser. So we're going to talk the difference a little bit about, Bailey's going to talk about hot and cold.
So, like we said, this is a hot laser. So, as the name sounds, it produces heat. Most cold lasers, they are a lot lower class. It also means the wattage is a lot lower. So, lasers are classified based on how they can affect the eyes. So, they're based on a range of 0 to 4. Class 4 lasers is this one. It will definitely affect the eyes, which is, again, why we use those glasses. The other lasers the cold lasers, those are usually class 3 lasers, so they only go up to a 500 milliwatts. This one is above 500 milliwatts and therefore produces a lot more beneficial healing effects, affecting that blood flow, directing all the energy to different tissues.
So the coolest thing about it is also with the laser strength, it penetrates the tissue deeper. So like on a cold laser, it's going to hit the surface, topical surface, so it's not going to really burn you. You can kind of hold it in place. This you have to continuously move around, otherwise it could actually burn you because it is so strong. It is the major benefit of it is the fact that when it penetrates you, it will go quite deep, accelerate the healing, you'll recover quicker, and you will need less treatments. So when we say by less treatments is, when we're talking about acute and chronic, acute issues require less treatments, because it's an injury that just happened. So when you accelerate the healing, it'll heal quicker. Chronic generally takes, so acute generally takes about 6, chronic takes generally about 12. Now every situation's different and every injury is different, and it's also depending on how you handle the treatment. Different injuries like disc bulge or people who've had back surgeries before or different things going on can take longer. Now with a chronic injury, what it generally does is it tries to go back to when you injured it and then start the healing process over. A lot of times with chronic though, you have to maintain it. So a maintaining schedule depends on how well the treatments occur. Generally, most people feel results after 3 treatments with the laser. And results mean better range of motion, mobility, less pain, all those things is what it can do. The treatment should not have many side effects. If it does, it's going to be a little bit of soreness, and sometimes you'll notice continuous heat flow. If that happens, you apply ice. There really is no side effects with the treatments.
So thanks for tuning in to episode 2 of the K-laser. Next week we're going to go over an actual K-laser treatment, discuss kind of how it feels, and we'll dive in deeper into the different tissues that this laser can affect.
And the best parts, we want to announce the winner of the most referrals and shares, and that is Jennifer Raley. Thank you so much, and everyone keep sharing, keep liking, and keep referring, and we'll have a new winner next week.
Yeah.
Bye.